Hello, and welcome back to the channel. It's your public health safe space, and today we're here to have another conversation. It's a warm day, it's beautiful outside. Let's get out, let's have this conversation. It's going to be a topic that should spur a lot of comments in the comment section, and I'm prepared. I want to hear your honest opinion, because sometimes we make decisions because we're unaware. Today, we're increasing our advocacy, increasing our perspective. Are you ready? I'm ready. Let's start talking. So as I said, we're outside and we're going to be having this conversation because it's important for us to understand the decisions we make. And we want to advocate for ourselves, but on a broader scale, we want to be able to advise others and share our knowledge. So today we're talking about a beauty conversation. This conversation is built around when beauty becomes a health decision, and this is a plastic surgery conversation. So I wanted us to sit, to focus, to just enjoy the views outside. So let's begin. Now, what if one of the most normalized beauty decisions of this generation is actually one of the least honestly discussed women's health decision of our time? What if what is being sold to women as confidence, self-care, body goals, maintenance, or just getting a little work done is actually something much bigger? Because at some point, a woman has to ask herself a harder question. When does beauty stop being cosmetic and start becoming medical? That's an interesting way to look at this conversation. When does a BBL stop being just a look and become a conversation about blood vessels, fat embolism, tissue trauma, inflammation, and survival? When do breast implants stop being just enhancement and become a conversation about scar tissue, rupture, revision surgeries, yes, revision surgeries, foreign materials, and long-term maintenance? When does liposuction stop being snatching your shape and become a conversation about healing, metabolism, muscle health, chronic inflammation, and how the body ages? And maybe the bigger question is this: what happens when women make permanent body decisions in temporary decades of life? Before, we look at the before is pregnancy, breastfeeding, chronic disease, hormonal changes, metabolic shifts, and aging have fully entered the picture. Before any of these come into consideration, we're seeing women make these BBL surgery decisions. Because what feels like a beauty decision at 24 can become a health decision at 44, a 20-year difference. And what looks empowering in one season of life can become physically, emotionally, and financially, and even medically complicated in the next cycle of life. Today, this is not a judgment video. This is not a don't do it video. Please don't misunderstand me. And this is not about policing women's bodies. This is about truth. This is about public health. And this is about making sure women understand what they are saying yes to, not just for the body they have now, but for the body they will still be living in 10, 20, and even 30 years from now. Because when beauty becomes a health decision, women deserve the full picture. So let's take a deeper dive into this women's health conversation. Let's say this clearly from the start, and I want us to really be clear about where we're going with this. Yes, men get cosmetic surgery too. Men get liposuction, facial procedures, jaw contouring, chest procedures, hair restoration, and body enhancement surgeries as well. So this is not about pretending women are the only ones affected. But this conversation is focused on women for one very important reason. Women make up the overwhelming majority of cosmetic procedure patients. The International Society of Aesthetic Plastic Surgery reported nearly 35 million aesthetic procedures worldwide in 2023 and stated that 85.5% of total aesthetic procedures were performed on women. Yes, over 85%. Liposuction, breast augmentation, abdominoplasty were amongst the most common surgeries. And for women, this conversation often lands differently because women's bodies are more likely to move through pregnancy, breastfeeding, cyclical hormone changes and shifts, fat redistribution, connective tissue changes, menopause, and a lifetime of appearance-based pressures. So this is not about singling women out. It's about being honest that women are carrying the bulk of this industry and therefore deserve the bulk of this conversation. Wouldn't you agree? Because once a body is cut, injected, suctioned, tightened, implanted, or surgically reshaped, this is no longer just about appearance. Of course not. All these things have occurred. This becomes a conversation about wound healing, blood flow, inflammation, scar formation, immune response, nerve preservation. Yes, nerve preservation, you wouldn't think, but it is. The long-term maintenance and what that body may still have to survive later is important to discuss. And this is why this is bigger than beauty. This is a woman's longevity conversation. It is a longevity conversation. Now, the biggest lie comes from saying it's just cosmetic. One of the most dangerous phrases women are told in this entire conversation is, it's just cosmetic. No, it isn't. No, it isn't. The moment a woman undergoes elective surgery, she is no longer just in the world of aesthetics. She is in the world of anesthesia, blood loss, tissue injury, wound healing, infection risk, inflammation, pain, scar remodeling, and long-term follow-up. And that matters because the body does not separate beauty from biology. The body only knows injury, healing, stress, adaptation, and consequence. That means every woman considering cosmetic surgery should also be asking questions like, how does my body heal? How does my body heal? Yes, very important. Do I have insulin resistance or diabetes? Do I smoke or vape? Do I scar poorly? Do I have chronic inflammation? Do I have autoimmune symptoms? Am I physically strong enough to recover? Am I nutritionally prepared? Am I planning pregnancy later? And this is one that most people don't even think about, is the planning of a future family. And am I doing this for long-term alignment or a short-term look? Those are not negative questions. Those are protective questions. Because a body in its 20s is not the same body you will have in your 40s, 50s, or even 60s and beyond, of course. And if you make surgical decisions based only on how something looks in this season of life, you may be making decisions your future body will have to carry for decades. This is why informed consent matters, because women should not only be told what it may look like in 6 weeks or how it may photograph in 3 to 6 months. They should also be told what happens after pregnancy, after weight changes, after aging, after scar tissue forms, after revisions become necessary. And of course, after chronic disease enters the picture. This is what real health education sounds like. Most people forget to think about chronic disease. But the chronic disease conversation is important. And this is the part that deserves much more honesty. Because cosmetic surgery does not happen in a vacuum. It happens in real bodies. Bodies that may already be dealing with prediabetes, diabetes, obesity, hypertension, chronic inflammation, autoimmune symptoms, arthritis, chronic pain, poor circulation, nicotine exposure, which is very important, poor nutrition, sleep deprivation, or metabolic dysfunction. And that matters a lot. Because if a woman already has a condition that affects wound healing, blood sugar regulation, circulation, collagen repair, inflammation, mobility, immune response, or tissue recovery, then the surgery and the recovery may not look the same for her as it does for someone else. And that needs to be understood. And that is one of the biggest truths women need to hear. The same surgery does not carry the same risk in every body. For example, diabetes or poor blood sugar control can complicate wound healing, infection risk, tissue recovery, and post-operative stability. Obesity or severe metabolic dysfunction can increase concerns around anesthesia, blood clots, fluid collections, wound separation, and strain on the body during recovery. Let's look at the one that I said was important, smoking or nicotine exposure. This can interfere with circulation, oxygen delivery, skin survival, and tissue healing. Now, looking at arthritis, chronic pain, or mobility limitations can matter too, because recovery often requires movement, positioning, circulation, compression, and physical resilience. And here is something that often gets overlooked. Women are more likely than men to live longer with certain chronic pain syndromes, autoimmune burden, or inflammatory conditions. And women also often spend years carrying untreated symptoms before being fully taken seriously in this healthcare system. So when a woman walks into a cosmetic consultation, she is not just walking in with a body shape. She may also be walking in with silent inflammation, nutritional deficiencies, chronic fatigue, insulin resistance, pain, hormonal stress, or an under-discussed medical history. And that matters. But not everybody should be approached like a trend body. A woman is not just a waist measurement, a hip projection, or a before and after photo. She is also a whole biological system. And if she is carrying chronic disease risk now or later, that must be part of the conversation. So we want to know when aesthetics collide with anatomy. If there is one procedure that forces this conversation into the open, it is the BBL. Yes, the famous BBL that some people just love so much. Because this is where beauty culture and medical reality can collide in a very serious way. A widely cited task force report from the Aesthetic Surgery Education and Research Foundation, ASERF, found that gluteal fat grafting had a concerning mortality signal, particularly because of pulmonary fat embolism, where fat enters the bloodstream and can travel to the lungs. This is not a beauty inconvenience. That is a life-threatening event. And yes, safety guidance has evolved. Technique matters, training matters, standards matter. but the larger public health issue remains. Some procedures are being marketed socially far more casually than they should ever be understood medically, because the body does not care that a procedure is trending. The body cares about anatomy, blood flow, pressure, trauma, and whether it survives the event safely. And that is the danger of influencer medicine. Yes, I said it, influencer medicine. Because too many women are introduced to serious surgeries through social media, vacation package marketing, transformation reels, music video aesthetics, and heavily filtered before and afters instead of anatomy, physiology, and surgical risk. That is why women need more than a gallery. They need real counseling. They need to know what could go right and what could go wrong, and what their own body may or may not be able to tolerate safely. Because some surgeries are not just beauty decisions, they are anatomy decisions with consequences. Now, let's think about breast implants and the maintenance truth that goes along with that. We're going to talk about one of the most common procedures in this entire conversation, breast implants. Because this is where many women need the most long-term honesty. One of the biggest myths online is that breast implants are a one-time confidence decision. They are not. The FDA states clearly that breast implants are not lifetime devices, and the longer they remain in place, the more likely complications become over time. Those complications can include rupture or deflation, capsular contracture, pain, scarring, asymmetry, infection, and future surgeries to remove or replace them. That means if a woman gets implants in her 20s, she may not just be making a young woman decision. She may be making a 30s decision, a 40s decision, a 50s decision, and possibly a lifelong surveillance and maintenance decision. And that matters, because what gets marked as confidence can later become monitoring, revision, removal, and management. The FDA has also documented systemic symptoms reported by some women with breast implants, including fatigue, brain fog, yes, brain fog, rash, and joint pain, while also noting that this area remains under investigation and this is not fully settled. And this is where maturity matters, because women deserve better than two extremes. It's all fear-mongering or every implant will ruin your life. Neither extreme is responsible. The truth is this: women deserve to know what is known, what is uncertain, and what still requires long-term follow-up. And women also deserve to know that the FDA continues to track cases of breast implant-associated anaplastic large cell lymphoma, a rare cancer of the immune system associated especially with certain textured implants. FDA reporting summaries note 1,380, that's 1,380 unique cases and 64 deaths reported as of June 30th, 2024, while also emphasizing the limitations of passive reporting systems. That is not panic, that is honesty, and women should not have to go searching for this information after the surgery has already been done. Then we have the category social media often treats like it's easy. Liposuction, Lipo 360, tummy tucks, body contouring combinations, And this is where a lot of women are sold an illusion. Yes, an illusion. Because people see a flatter stomach, a smaller waist, a rounder silhouette, and think they just removed fat. But surgery is never just, in quotations, it's never just. When fat is removed, tissue is disrupted. When skin is tightened, tension is created. When multiple procedures were stacked, the body is asked to recover from more trauma at once. And that recovery is not just about looking good in compression wear. It is about circulation, swelling, inflammation, pain, mobility, nerve preservation, scar behavior, and how the tissue behaves over time. The literature on abdominoplasty has documented post-operative concerns, including persistent sensory changes and nerve-related complications, which matters because women are often shown the final shape, but not always fully prepared for how surgery may alter sensation and tissue behavior afterward. And this is where the message has to be crystal clear. Surgery does not replace fitness. Surgery does not replace metabolic health. And surgery does not stop aging. That is the truth. If someone does not build muscle, support recovery, stabilize their weight, protect their nutrition, manage inflammation, and care for the body long term, then what they bought as a look may become something they have to keep paying to chase. The long-term cost is consequential. And that is not always because the surgery failed. Sometimes it's because biology keeps moving and changing. Bodies change, hormones change, skin changes, muscle changes. And if a person is doing surgery for a temporary look without long-term health plan behind it, that can become a very expensive and physically demanding cycle. This may be one of the most important parts of this entire conversation that we're about to have, because many women are making these decisions because they have children, and that's important to address. Not because every woman must have children, but because many women do not yet know whether they will become pregnant, how many pregnancies they may have, how their skin may stretch, how breastfeeding may affect their chest, how hormones may shift body fat, or what postpartum recovery will actually look like. And that matters when making permanent or semi-permanent body decisions. A 2023 systemic review specifically looked at pregnancy after abdominoplasty, making it clear that this is a real clinical consideration, not just a cosmetic footnote. And breast implant counseling also includes discussion of possible impacts on breastfeeding, according to the FDA. So the real question is not, can I do this? The real question is, do I understand what my body may still have to do later? That is the mature question, because your body is not just a shape. It also is vascular tissue, endocrine function, connective tissue, muscle support, immune response, reproductive potential, and long-term healing capacity that deserves respect. And too many women are being encouraged to medically redesign themselves before they have even had the chance to fully live in the adult body they are still becoming. This is not a moral issue. This is a health issue. So now let's talk about the question almost nobody is marketing to women in their 20s. What happens after 50? Because the internet is obsessed with how the body looks today. Public health has to ask, how does it age? How does it function? How does it recover? How does it feel? What happens when surgeries done young have to coexist with menopause, muscle loss, slower healing, connective tissue changes, scar maturation, inflammation, arthritis, metabolic disease, and long-term wear and tear on the body? Because after 50, the body is not just managing appearance. It may also be managing sarcopenia, joint stress, chronic pain, skin thinning, hormonal shifts, metabolic changes, and slower recovery from intervention. And if a woman already has diabetes, obesity, arthritis, cardiovascular risk, or chronic inflammatory stress, that aging process can become even more medically important. That is why it is a longevity conversation, because the question is not, did I look good at 27? The question is, what does this body feel like at 52? That is the grown woman question. That is the health question. That is the question more women deserve to ask before they say yes. Because beauty that requires repeat intervention, constant revision, long-term discomfort, or a physical burden the body may not want to carry forever is not a light decision. It is a healthcare decision. And this may be one of the most practical parts of this entire conversation. Because if a woman is going to sit in a consultation and they should not only go in asking, how will I look? She should also go in asking harder, smarter, more protective questions. So, here are 10 strong questions every woman should consider asking before cosmetic surgery. And for the purpose of your understanding, or for those who may be considering it, you are able to stop the video, slow it down, repeat, play back, so you could take notes. So here are the questions. 1. Based on my current health, what are my personal risks with this surgery? 2. How would diabetes, insulin resistance, obesity, smoking, inflammation, and poor circulation affect my health and recovery? And I should interject here and say this. These questions work only if you are honest with your provider. So you have to be honest. These questions become pointless if you are not honest. 3. What are the most common short-term complications? And what are the long-term complications? 4. If I get pregnant later, how could this surgery affect my body or my results? 5. We're halfway through. How could this affect breastfeeding, sensation, or future body changes? 6. What kind of maintenance, monitoring, or revision surgeries are common over time? Number 7. What happens if I gain or lose a significant amount of weight later? 8. What warning signs after surgery should make me seek urgent medical care? And that's an important question. 9. What does this procedure realistically look like 10 to 20 years from now? And finally, number 10. Am I healthy enough physically, nutritionally, and mentally to maintain this result safely? Those questions, those 10 questions I just did, they matter, because every woman walking into a consultation is different. She has a different body, a different healing pattern, a different diet, a different pain threshold, a different medical history, a different stress load, and a different future. And that means women deserve more than a sales pitch. They deserve a real conversation. So let's close this honestly. This conversation is not about shaming women. This is not about pretending that every woman who gets cosmetic surgery is reckless, vain, or uninformed. No, please do not misunderstand me. Some women feel restored by surgery. Some feel more confident after surgery. Some feel empowered by it. That is real. But this is also real. Empowerment without full information is not empowerment. It is marketing. And women deserve better than marketing. They deserve honest risk, honest long-term expectations, honest chronic disease screening, honest conversations about reproduction, honest conversations about aging, about body maintenance, and honest conversations about whether the life they are living can actually support the surgery they are choosing. Because when beauty becomes a health decision, the issue is no longer can this be done. The issue becomes, what will this cost me later? And women, every woman deserves the truth about the signs that consent that comes after you sign that consent form. If this conversation matters to you, please share it, because this channel is about advocacy, public health, women's health, informed truth, and making sure people have the information they need to protect themselves. And sometimes the most powerful thing we can do is ask better questions before it's too late. Thank you for being here. I want you to be honest with yourselves. You should be honest in your conversations with your provider, honest in your conversations with friends, and share the video, like, comment, and subscribe. This is an important topic, and I appreciate your comments ahead of time. Thank you so much. And again, I'll see you for the next conversation. It's a beautiful day. Enjoy. Your perspective has grown, and so has your ability to advocate.